Let's start to differentiate between the cervical injury and the traumatic brain injury. Now, obviously, there are two completely different injuries, two completely separate injuries, right? So if I damage my brain, but I don't damage the spine, I have a brain injury and not a spine injury. If I damage the spine, but don't damage my brain, I have a spine injury and not a brain injury. Now, let me give you that a little bit easier. I'll slow down. If I have a cervical injury without a shoulder injury, then I have a cervical injury without a shoulder injury. But if I have a shoulder injury and no cervical injury, I have a shoulder injury and not a cervical injury. Now, here's the problem between the traumatic brain injury and the upper cervical ligament injury or the spine injury. The symptoms of an upper cervical spine injury will mimic and are the same symptoms as every symptom of a traumatic brain injury. Now, the only difference is the deformation of the tissue. Remember, all injuries are a deformation to a body part, a derangement to a body part. The upper cervical injury, C4 and up, is very easy to identify with testing, very easy to identify with CRMA testing, very easy to identify with good stress x-rays, stress radiology. Right? Now, the brain injury and the actual damage to the brain is oftentimes more difficult to pick up. The functional problems, person has headaches, person has dizziness, person has blurred vision, person has balance difficulties. Those are functional problems associated with a brain injury, but they're also associated with an upper cervical injury, upper cervical ligament injury. So it's very difficult. The upper cervical ligament injury, if I have an upper cervical ligament injury, I can have blurred vision from it. I can have balance difficulties from it. I can have tinnitus from it. I can have TMJ problems from it. I can have an autonomic system dysregulation as a result of it. I can have drop attacks. This is all the cervical injury, the upper cervical injury. I can have paresthesia from it. I can have pain from it. I can have slurred speech from it. I can have difficulty with my breathing from it. I could have cognitive dysfunction from it. Now, this is me saying it. Just look it up. Just go to Medscape and say, hey, what are the clinical, what's the clinical presentation of a spinal ligament injury, of a sprain, cervical sprain? You're going to see everything that I just said is there. Now, here's the truth of the matter. That injury and that deformation will cause those symptoms. Now, in the brain injury, it's tougher to find the actual deformation. How injured is the brain? We usually measure that functionally, right? But we can't say, well, you know, gosh, they damaged, it's a grade 3 brain injury because the brain is so deformed. We looked at normal formation, there's no abnormal. Then we looked at abnormal, geez, got dented this much. And then we went, oh, wow, it really got dented this much. So it's a much higher level problem. Just like the disc. We look at the disc and say, hey, it's bulged. Well, is it damaged? Yeah, but is it the same as a herniation? No. Is that herniation that effaces the nerve worse than the herniation that doesn't? Yes. Is the herniation that actually impinges on the cord worse than the one that doesn't? Yes. So how do we determine how badly a disc herniation is? By how badly it deranges. How do we determine the non-disc ligament damage? By how badly it causes excessive motion. How do we determine how badly damaged the brain is? It's tougher. So what I'm saying to you is that the cervical injury will mimic and cause every single symptom. If I damage your eye right now, it's going to cause visual disturbances, but it's not going to cause a cervical injury. I can put a needle in your eye right now, and I'm not going to damage your cervical spine. I can also damage your inner ear without ever damaging your cervical spine. It's going to cause balance difficulties, but it's not going to cause a cervical injury, right? So I can cause those things, and it's not going to cause a cervical injury. you could have cognitive dysfunction. Let's say that you were going through a divorce and you lost your business and you were going through an IRS audit and everything was just going bad for you. Do you think cognitively you're going to score high like you would if everything was going good for you? No. So you could have a low cognitive function or cognitive worsening, never going to cause a cervical injury. But the cervical injury can cause cognitive dysfunction. So because the cervical injury can cause all of these things, it's the senior condition. And it's the condition most in the traumatic brain injury space, in my experience, that gets the least attention. And so people do not correlate it with the thing that is going to cause help in the traumatic brain injury space. The doctors that understand this condition, in my experience, are some of the best in the market at that condition and helping to improve it, because the people that do not recover from the traumatic brain injury dysfunction oftentimes is because the cervical injury was missed and the providers who are working with that patient don't understand it and don't know what to do with it to try to improve it to reduce down the patient's symptoms. So the traumatic brain injury space is one of the easiest spaces in my experience for experienced doctors who understand spinal ligament injuries to be of high value for. Remember, the market today is after results. And if we say make America healthy again, this isn't to get political, it's just to say, hey, if we want to make America healthy again, then we have to start to use the things that actually improve the condition and do it in a really good, cost-effective manner whenever possible. And that has the best long-term outcomes as a result of it. So what I'm saying is that the doctors that are super value in the market are there because they can fix things, not because they maintain things, not because they just treat things, but because they're stabilizing and fixing things. And when you're looking at that traumatic brain injury market and the cervical instability market, the doctor that understands the cervical instability and is able to knock out those conditions is one of the key players, if you will, in the traumatic brain injury space. That's in my experience.